What they're doing is right now they're putting their Humpty Dumpty together. Okay, so they're going to come up with their big fat bill, and then that's going to go to the Senate floor for a vote. When this gets done and this gets done, they bring them together in what's called conference committee. And in conference, what you do is you reconcile the differences between the House and the Senate. You put that together, and then that goes back out for a vote in both the House and in the Senate. The important thing about that bill is you cannot offer any amendments. The big one that comes out here on the House floor and the big one that comes out here in the Senate can still have amendments offered to them. Once they get done with it here, it's up or down. Whatever in it, even if there's some things you don't like in it, you want it, you're taking it all. So all of the, and we squeeze this little thing in there, is all the jockeying that's going on right now. When that gets done and they bring it together down here, that's when it's over.
So when you get back, I want to go back to the House and the three committees doing the Mongo bill. How many, it means the staffers who are really doing the work?
All of it.
And how many folks are actually doing this? And how many of them actually have any medical background?
Very few. Very little medical background. They do have...
Healthcare background, I should say.
Not many of them. There are an exceptionally few number of clinicians, which is part of where my advocacy is about making sure, I think health policy should be a required course of every undergraduate student that comes through Penn. It's appalling to me that it's not. It should be seriously integrated into everything we do. And you know why? Because that keeps us responsible and gives us the community ethic that we should have. Because we don't, we lack the access and the opportunity to go in and be able to take positions. It is not that there are not physicians and nurses and social workers and all of that there, but they are the modicum. They are not majority. Now what you do have are really sharp people who understand public policy and understand a lot about a number of issues. But the nuances of what we can do to give them what they need to be able to write the legislation, we have a lot that we could offer. And what we need to do is to seek opportunities to inform them about what's the right thing we should be doing. And if they want to go in and listen to us, and then listen to physicians, and then decide for whatever set of political reasons what they want to put in, that's their choice. But we have the raw material that we could be giving them. Very few. The committees have a number of staff, so the larger committees will have more staff, and you have staff that's on for the minority and the majority party. So you have two separate staffs, ones that are going to work for the Democrats, one that works for the Republicans, and but when you're in the majority, you have more staff because you're initiating legislation. But a lot of them work together. Less so now than used to be. The Hill is so bitterly partisan in ways that are so counterproductive. They're not even thoughtful. They're not useful. I think you should have a healthy debate. And that's not what we're getting. Just look at what happened to the president as a result of being given the Nobel Peace Prize. Hardly something he campaigned for, right? But it wasn't, within an hour, you heard it all turn into, like, well, who the hell is he? This, that, rock star. Do we have to take everything? I don't care. I was not a big fan of George Bush. I would have said the same thing. They did it there. Do we have to turn everything into a political attack? We're not helping the American public right now. But the staffs vary. There's a lot of them and they're doing all of the work. And what their job is to propose legislation that moves the agenda of the member, so whomever they work for, or for their committee, in a way that moves things in a positive direction. But I think we have a great opportunity to provide them with what they need. So the big debates now are, right, how many of the uninsured can we bring in health reform? How many of these 47 million people are we going to bring in? And what's the vehicles for bringing them in? Do we continue to support employer-sponsored health insurance, which is what the majority of people have? Do you take Medicaid that pays for some poor people but not all, and do you expand it so it covers more people? So of the people that are in a lower socioeconomic strata, do you cover them with Medicaid? The people who are uninsured, do you create options for them to become insured? And for the people who are insured but have Swiss cheese or holes in their insurance, they're paying a lot of money and they don't get much covered. They're the underinsured. Can we provide them with some protections so that they don't go bankrupt and fall into the uninsured? So there's a number of things we have to do for those who have no insurance, people that are in government-sponsored insurance, people who have private insurance but have holes in it. And where does that money come from? How much money can come from the federal government or from your state government, and how much is going to come out of your pocket? Every time you say, okay, everybody has to have coverage. Anybody from Massachusetts? Okay, so you pass the individual mandate, everybody has to have insurance, right? So if it's unaffordable, what do? I mean, do you not eat? So you have to say, well, if it's not going to be affordable, then the government has to give you a subsidy so that you can purchase it. Well, if you don't control cost, bending the curve, if you don't control cost, the government has to spend more in subsidies. So that's where the big debate is now. Who's going to get a subsidy? How much is it going to be? Because all of that goes into the CBO score of how much is this going to cost the government and how much is it going to cost us. That's one big debate. Where the money is coming from is the second big debate. So once you figure out who's coming in and whether they're going to get in, whether there's going to be a public option or an opportunity for them to elect a government-sponsored health insurance plan, which would be, I don't know why they just don't put them all in the Medicare. Quite frankly, that'd be much more efficient. But yeah, that doesn't, get a lot of light of day.